our window to our expressions, right? One day when you wake up, you are not able to express yourself, and it is a hard place to be. But don't worry, it is going to be all right. Physical therapy plays a huge role in your recovery related to Bell's palsy. So if you're someone who's suffering from Bell's palsy, in this video today we will talk about certain muscles of the face, what action they do, so you can do certain exercise with that. So this will be useful not fully only for patients who are suffering, but for the students who is trying to study the muscles of the face and expressions. What is Bell's palsy? So Bell's palsy is something that we call the one side of the face muscles are becoming weak. What happens is you see like this, you see the face like this, thinking that this side is affected side. No, the smooth side, the side where the wrinkles, see the wrinkles which is lost. If this side wrinkles is lost, then the smooth side is usually affected. Why this is happening? We call it idiopathic. We don't know the exact cause of this happening, but the reason what is happening is that you have nerves here that called facial nerves. So facial nerves is one side, this side, two different nerves are coming, and it almost comes in this area. I will talk about the anatomy of the facial nerve later, but it almost comes through this area and supply different branches it supplies. So one side nerve is supplied by one facial nerve, other side is supplied by another facial nerve. That's why when you see a facial nerve involvement and inflammation of the facial nerve around this area, you will see compression. So the facial nerve exit through skull area. So there's bones come when the facial nerve get inflamed and get impinged between this small bony area. If this is a small area that facial nerve exit, normally the facial nerve go like this, but when inflammation is there, they will get compressed. So this is the reason. Once that compression comes down, usually we will start to see the improvement. So once that facial nerve is here, so if it inflames this facial nerve, the muscles this side become weak. So that is the reason, but we exactly don't know the cause of the inflammation of the facial nerve and the compression happening. But if you see, usually Bell's palsy come entire upper and lower part of the face. But if you see the upper part is not involved, you might need to doubt about a stroke, because usually this side is supplied by both contralateral and ipsilateral side of the brain. So you might need to go for a stroke related things, because usually Bell's palsy involved entire upper and lower part, full weakness will be there. Facial nerve anatomy, it is not just the motor movements they are playing a role. They are playing a role in related to our salivary functioning, our lacrimal eye drops, our saliva. That thing autonomical nerve is supplying is also from the facial branches there. Once you understand the anatomy of the facial nerve, which we will be making a video, you could get much more deeper understanding about the problems that can be coming from a facial nerve involvement. Anyway, so that is basically what Bell's palsy is, and if you're someone suffering from the exercise that we are going to show, you need to follow. So if you're now in a stage, that early stage, but early stages of the inflammation, and there's a complete paralysis, complete weakness, not even a small contraction is happening in your face, you might need to go start with something called electrical stimulation. Electrical stimulation, what it is doing, that all we will do in another video. Today what I wanted to teach you and make you understand is the facial muscles, where it is, what it is doing, so you can do certain exercise that you can try in your home only. So today we are going to learn about a specific few exercises that can be used if you are a patient who has Bell's palsy. This is called neuromuscular re-education. So for neuromuscular re-education exercise, you need a mirror. Why you need a mirror? Because what we are trying to do here, we are getting a feedback. So we use the mirror and give a feedback to the brain. Using that, we are training our muscles. So when you have a Bell's palsy, you will lose motor control of entire weakness of one side of your face. To re-educate these muscles, you need to use feedback of the mirror. So these exercises you need to do in front of a mirror and teach these exercises yourself. To do this, you maybe right now you have a complete weakness of one side of the muscle. So what you want to do is you need to first we need to understand what is the action of the muscle, where are the muscle. So if you see the muscles and the action of the muscle, the exercise become much more easier. And one rule of this exercise is you need to the muscle is not actually moving right now. So what you need to do is you use your hand and help the muscle to move. So you basically lift that muscle using your hand. At the same time, do the same movement in the active side, in the normal side. So the first muscle we are going to see here is frontalis muscle, right here in front. This muscle is called a frontalis. What is the action of the frontalis? So frontalis muscle is in this area. It is basically this eyebrow is raising. The both eyebrow is raising. So to facilitate that neuromuscular facilitation, in front of the mirror you go and sit and try to raise using your hand. Try to raise using your hand. That is the frontalis muscle right here. Raise. Next muscle, the blue color muscle right here. It is called corrugator supercilii. What is the action of the corrugator supercilii? It is basically making in some type of an angry face. So the eyebrow should come medially and downwards. This is corrugator supercilii. So that you can facilitate like this. Right? That is corrugator supercilii. Next, the big muscle around the eyes. In this entire area you can see one muscle, that is orbicularis oculi. This muscle right around this area is called orbicularis oculi. What is the action of the orbicularis oculi? It is basically closure of the eyes. The eyes are closing like this you can close. So you can passively use this to close the eyes. Next muscle here, this red part around the nose, that is called nasalis. What is the action of nasalis? Nasalis action is basically firing. You will see when you breathe in, right? When you breathe in, this side of the nose is going to flare. This you can train because it is actually hard to facilitate using your hand. So nose and then slowly breathe out. At the time you breathe out, it usually go to flaring. So breathe in through your normal nose and breathe out through your affected side nose. So it will flare. You can see around the mouth, this area we call it as orbicularis oris. What is the action of orbicularis oris? Orbicularis oris is a kissing muscle. You will do this protruding the limb. This is orbicularis oris. We have a muscle called this side of my face, it is called rhizoids. What is the action of the rhizoids? Rhizoids is basically do this. Pull this thing. So you can use your hand and pull, assist. Here in the down area, in this area it will be coming, that is called mendalis. What is the function of mendalis? Mendalis will be this action, protruding the lower lip. So how can you facilitate it? You can literally hold on this section. Buccinator muscle, this area buccinator. So basically what it do is, it will put your cheek close to your teeth like this. You know, there is one pimple will come right that side. That is action of the buccinator, like this. Anguli oris. Levator anguli oris will be around this area. It will help you to lift this smiling this. Levator anguli oris. Levator anguli oris will be around this area. It will help you smile. This violet color, that is called levator labii superioris. What is action? Side. Just raise this upper, around this area it will come levator labii superioris. So it will just pull like this. This is levator labii superioris. What it basically do is just making a sad face. From around this area this muscle will come, so it will pull down this sad face. This is depressor anguli oris. Depressor anguli oris will come. So these are some major muscles of the face, and these are the major muscles of facial expressions. And if you comes to know what are the muscles and where it is and where is action, you can basically train yourself, or you can re-educate your muscles to work it properly. One of the ways one of the common problems that we see in Bell's palsy or facial paralysis is synkinesis. Synkinesis is basically you try to raise your eyebrows, but your one side of the lips will go. That basically your brain is telling to raise, but the other muscle might be acting. Synkinesis of the movement is happening. To avoid all these complications and to get a perfect movement, you need to train your muscles in this way: neuromuscular re-education. In front of the mirror, you give feedback and you train your muscles. These are the muscles and muscles of facial expression, and these are the actions.